Good evening. Thank you for joining us. There is, in fact, a crisis. There's no point pretending that it is anything else. The second wave that we're looking at right now across the country does look like a crisis for many reasons. One is that the spike is higher than anything that it has been over the last 1 year. There has been widespread reports of shortage of beds, shortage of oxygen, shortage of ICU, shortage of ventilators, shortage of Remdesivir, which is a drug that is used, an antiviral drug that is used for patients suffering from severe COVID symptoms inside of hospitals. There has also been, at least anecdotally in the city of Mumbai, a shortage of testing kits over the last 48 hours. Where does this leave all of us? At the same time, we see large political gatherings also taking place in some parts of the country. Is it in pockets that we're seeing this right now? The other thing that has worried me, and the reason why I felt we need to have this conversation, is because there are doctors writing on Twitter about different symptoms this time around, different from what we saw last time. About the fact that that people under the age of 40 are getting admitted, that the virus and its impact is taking a very drastic turn after day 4 or 5 of infection, and people are suffering from breathlessness and they're needing oxygen a lot more than was seen last year. Just to be able to understand all of this and put it into perspective, my team has been trying for a couple of days to get the person we trust most of all when it comes to public health, Dr. Professor K. Srinath Reddy, who is the president of the Public Health Foundation of India and an extremely strong voice on matters of vaccines and of public health care. Dr. Reddy, thank you so much for making time. And I know that your expertise is under great demand at this point, so I appreciate it. Let me get straight to the point about the symptoms. Have you also received reports that the symptoms this time are different from what we noticed last time? Is there something the audience should know about it?
I mean, a lot of people have been commenting on it, and some people have been writing about it, even in the media. But let me just comfort you by saying that this is not entirely a new phenomenon that we should be getting very worried about. And there is an explanation for this. For example, having fever as one of the prominent symptoms. Well, even among the first 3 symptoms that were listed by the CDC of USA and the WHO, fever was very much there. And the fever, cough that is mostly dry cough, and breathlessness were considered to be the triad. Then the symptoms were expanded to 7. Then the symptoms were expanded to 11. And now we are seeing, of course, variations and different combinations because the virus itself is affecting different parts of the body with different levels of intensity. The symptoms that you get are partly dependent upon how severe the infection is in terms of viral load, what the age of the person affected is, what is the level of the immune response, and how tenacious the virus is in terms of moving around different parts of the body and producing different disorders. So ultimately, what is happening now is that you are having the variants of the virus, which are much more tenacious. They stick to the walls of the cell much more with much greater intensity, and they can manage to penetrate the cell. Therefore, the level of infection that a person gets is much higher than in the past, because these viruses are not going to give up before they enter the cell. So then the second thing is, younger the person, usually stronger the immune response. Elderly people have a weaker immune response, and fever is often a manifestation of that immune response. Of course, if you're getting a fairly severe illness because of a very high viral load, even elderly people will get the fever. But generally, the younger people have a better immune response to try and fight off the infection. So in that sense, it's one of those manifestations. And because in the first wave, we saw many of the older people affected, and also now, many of the older people have already received the vaccine. Yes. It is the younger people who are getting much more affected, and it's not strange. But this phenomenon has been seen in the UK as well. In recent months, it is mostly the young who have been getting affected. So while it is definitely something that is happening a bit new, which attracts attention, it is not a feature that should make us terribly worried. Of course, if the virus is more infective, is more tenacious, then that is a matter of concern. And the fact that the virus mutant is going to have some slightly different manifestations from the original virus is expected on the pattern of its behavior.
Doctor, there's a question that has come in from Yashaswini Basu, who says the new variant is seen to be less fatal so far. Do we have enough data to believe that? This was actually something that was said initially, but I think the people are coming out of that, misconception, if we may call it. Is there anything to suggest that it is that more people are asymptomatic and hence this is a less fatal variant?
Again, the British, for example, said that this is not only more infectious, but appears to be also more virulent than, and possibly causing more deaths. That's what they had mentioned earlier. But then the problem, of course, is that different parts of the world have been reporting different patterns, and depends also on which mutant it is. For example, Punjab and Delhi seem to have more of the British variant, the Kent variant. Mumbai seems to have more of the double mutant. So each one of them may have a different manifestation. There are several doctors from Mumbai, for example, saying that it's far more infectious, but actually the recovery is taking place faster. So we cannot really say right now, because obviously if you're younger, even if your symptoms are very prominent, you're likely to recover faster, and more recoveries are likely to take place than if you're 65 or above. So we'll have to gauge all these factors and adjust for age and other factors. As of now, all we can say is more infectious. The severity may vary depending upon a number of other circumstances.
The question that that brings us to then is how we at the very beginning of this second wave, do you expect it to continue for the rest of the year? Because the chart is quite scary.
It is scary because we have actually now started experiencing the second wave in a fully open society. Whereas in the last year, we had the lockdown starting when the cases were relatively less in number. Yes. And then we also started releasing in stages. So we did not have a fully open society where we experienced the full upswing, and then we started seeing a steady downswing. Now, in a completely mobile, open society, which is working full steam, traveling all over the place, the virus and its mutants, which are more infectious, are having a field day. Now, they will be around for some time, but the question is how long? We do not know. And it depends entirely on the way we respond. If all of us determine that we are going to be wearing masks, the right kind of mask and the proper way, and we will avoid crowding either indoor or outdoor, then if we do that for 4 weeks at a stretch all over India, without exception, then the virus will not get much of a chance to transmit itself, and it should start coming down quite significantly. But on the other hand, if that pattern of behavior is not established and we give enough scope for the virus to move around, then we are going to see a much more protracted course.
And just for our audience, the chart that you're looking at on your screen, it's very easy to find. You can just look for COVID cases in India. This is the Google chart that comes up immediately. What's interesting is that what looks like a small bump now on the 21st of August to the 3rd of November was the worst of last year. And we are currently ahead of that. We're higher than the worst of last year. And that's perhaps the reason for concern. You did say, Doc, that it would depend on all of us sort of deciding that we want to follow COVID appropriate behavior. But at the same time, we have election campaigns going on. We see photographs of large groups of people who have gotten together. We see the Kumbh Mela photographs that are of large groups of people. Is that reason for concern? Because actually, if we look at the worst numbers, they're out of Maharashtra at this point. They're out of UP, Chhattisgarh, Kerala, Karnataka. It's not really in the regions where we're seeing these large groups of people.
Psychologists have a term for it called cognitive dissonance. We believe something and behave very differently. And unfortunately, that is true of most classes of our society. And that is the pattern we are seeing now, that people should not crowd. But there is a tendency to yield to temptation and start having social gatherings for a variety of reasons, whether it's political, religious, or social celebrations. It is happening. And this is partly due to the fact that the threat perception had faded quite a lot. We sort of took it for granted in early January that we have been blessed with herd immunity. We started looking for genetic causes of herd immunity and so on and so forth, that Indians are unusually blessed to escape the pandemic because of some inherent protective factor. And then we felt that we are no longer vulnerable to the virus. Now we are getting a lesson in humility, saying that we have that vulnerability and that we must actually behave ourselves much better. And we have to follow the appropriate precautions if we really have to end this second wave soon.
Doctor, the other questions that people are asking right now is about the possibility of getting the virus the second time around if they already were infected in the last 1 year. Are there a lot of reports right now of reinfections?
Not too many, but it's entirely possible that you can get infected. Many of the people may not know that they've been infected, but some may, for the simple reason that the infection may actually give immunity, which fades away after some time. We know that the antibodies start fading away after 6 months, and even the so-called T-cell immunity is also, and we are unsure how long it's going to last. But remember, there's a contrast between the vaccine and the natural infection. The amount of viral load that a person receives in a natural infection is extremely variable. It could be a small viral load, it could be a very large viral load. And if there is a strong viral load, then the immune response is strong and lasts longer. If it is a relatively small viral load, people may not feel any symptoms or they may have mild symptoms. They recover fast, but the immunity also fades fast. So it is likely that some of the people who are getting reinfected are those whose immunity has faded for a variety of reasons. Even among the elderly, where the immune response is not as strong as in the young, again, the likelihood of reinfection is more. So that's why the priority for immunization.
I have to ask you about the vaccine shortage. Now, we hear today that the government has decided that it will fast track the approvals of vaccines from overseas to also be available in India. This is completely contrary to the tone of the government a couple of months ago, where we're calling ourselves the pharmacy of the world. We were bragging that we've exported to other countries more than we've made available to our own people, that we were going to look after everybody else. At this point, we find ourselves at a shortage. Is this mismanagement, or is this bad planning, or was this likely to happen anyway?
The confidence of the batsman differs upon the changing pitch conditions. You may bat very well in the first innings, but when the pitch changes character, the same batsman may start having problems. And therefore, we are seeing now in the second wave, when we are suddenly seeing a huge spike and finding our hospitals crowded, and we are also finding that there is a shortage of whether it's oxygen or beds or whether it's vaccines. I think obviously now there is a need to think of other strategies. And the other strategies will include getting vaccines as fast as we can from wherever we can. And I think that change of strategy is what's being implemented now.
Doctor, you did talk about the fact that we're running a shortage at this point of hospital beds, of oxygen, of Remdesivir, of various things. Again, did we not know of the second phase? Again, is this bad planning? Did we, a lot of times even the Maharashtra government has turned around and said that this is happening because people who don't need to be hospitalized are getting themselves hospitalized as a precaution, and that's what's taking up the beds. Do you agree with that, or have we just not been prepared?
No, there are multiple reasons why the beds are under pressure. Firstly, it's possible that because younger people are getting affected and they want now to get hospitalized to get themselves checked up, they may be as a matter of prudent behavior, they may want admission. But also remember, by mid-January, most people thought that the pandemic was over, and hospitals started admitting other patients whom they were refusing admission to in the past. A lot of elective procedures that were postponed were now being accommodated. So hospitals were full up as they were before the epidemic started. And now suddenly you can't start throwing out patients either. So there is a competition for beds now. So there is a period of transition in which the existing facilities are going to be under great pressure. And this situation is certainly not helped when you see a huge surge of cases suddenly coming up at a much faster rate than in the past because of the effect of the variants. So the pressure on the beds is very understandable. But whether we could have prepared for it and anticipated is a different question, because the thought in middle of January was that we may not need it at all. I mean, that's what the general perception was.
To believe that the pandemic was over was perhaps a little, we sort of jumped the gun a little bit, because Europe at that time was going through its second phase. France is now calling it its third phase. Are we likely to see a third phase as well?
Well, I completely agree that it was an incorrect appraisal of the situation to believe that we had ended the pandemic and we would never have that threat again. I was one among several, I won't say several, but several people saying that, no, we must keep our guard up at least till April and watch the situation before we start saying that we are out of the woods. And we ought to have actually still observed a lot of public health precautions, in which case we could have averted this problem or at least minimized the scale of the problem. And therefore, we have to make sure that till people acquire a certain level of immunity, preferably through a vaccine or at least through a natural infection, so that they can remain protected from severe infection. Because even the vaccine does not guarantee you that you won't get any infection. It only gives you the assurance that you won't get a severe infection. So till that time is reached, we have to maintain our precautions in the society. I'm not saying that everybody must live under lockdown, but there are certain common sense precautions that have to be taken for some months to come now.
Doctor, a couple of questions that are coming in. People are concerned about reports of blood clots. Again, the reports have largely coming from overseas, but are we monitoring vaccine, candidates or vaccine, people who have received the vaccine enough to know whether there are blood clots reports in India? Is this something we need to be worried about?
Well, the vaccine that is really under scrutiny is the AstraZeneca vaccine. Though today, even the Johnson & Johnson vaccine in the United States has joined that list of having blood clots, and they've put a stop on that temporarily. Now, these are what are called virus vector vaccines, in which a supposedly harmless virus is tagged with a DNA code for producing the spike protein. And it is the spike protein which the virus uses as the door opener for the cell. And the harmless virus is supposed to carry this code into our cells so that we start producing in our body the immune response against that spike protein. So when the actual virus turns up and tries to invade our cells, it is attacked at the level of the spike protein and disabled. So that's the theory. Now, unfortunately, for some peculiar reason, these two vaccines, which are carrying the adenoviruses, in one case, it's the chimpanzee virus of AstraZeneca, and it's a human adenovirus in case of the Johnson & Johnson. They seem to be causing a peculiar clotting problem, especially in young women in the reproductive age group. And it is causing an unusual combination of manifestations where you're having a very low platelet count platelets are the things, the sticky cells in the blood, which actually help create plugs and clots. But here you are seeing the platelets go down, but the clotting is actually happening on some of the big veins in the stomach and in the brain, and sometimes in the arteries as well. Occasionally, it can be accompanied by bleeding, but the most unusual manifestation is if the platelets go down, as in the dengue fever, you get bleeding. But here you're getting clotting and in unusual locations. So this is something that people are understanding, trying to understand. It appears to be an autoimmune reaction to some component of the vaccine, and we have to study a lot more about it. The only reassuring thing is it's a very rare side effect. It's estimated to affect 1 in 100,000. Now the question is, which 1 in 100,000? Now, because young women seem to be more affected, most countries in Europe have decided that younger people in general should not be getting the vaccine. It can be given to older people. Now, whether we take the same decision or not, we'll have to wait and see. But so far, the reports coming from our ministry is that adverse events of this nature have not been reported in India, but they've just, I think yesterday, revised the advisory for how to monitor adverse events to get more details of stimulus.
Doctor, I'm going to ask you a question that may put you on the spot. I'm asking this actually very honestly. You did say, of course, that there are reports from the ministry that said that it might be very rare or it hasn't been reported. But this is the same ministry that rubbished claims from state governments that they were running out of the vaccine. It then sort of scolded those same state governments for not doing a good enough job and has still yet to acknowledge the fact that we're facing a shortage at all. Now, how, as a citizen, do I take reports that come out of this ministry seriously anymore if they're not, if they're going to continue to basically refute something that is plain as the sky is blue, that we do in fact have a shortage of vaccines? There is a lack of credibility now in the statements being made by the ministry.
Well, Faye, it's like this. As a scientist, I'll have to look at data to answer. Now, yes, on vaccines, we know that there is a shortage. There is sufficient data to show that there is a shortage. On whether these kind of complications are happening in India or are only confined to Europe and North America, we are not clear about it because we have not had reported incidents from India. Either doctors who are seeing it go to the media and report it, or ideally they should be reporting it through the appropriate channels to what is called the adverse event monitoring process. Now, if that is not turning up there, we cannot say with confidence that this is happening. But all I would say is that we must keep a very good lookout for it. And if it is happening, we must not underreport it or hide it.
Many state governments have also called right now for the board examinations for 10th standard and 12th standard to either be cancelled or postponed. I know that I receive emails and messages from students from all across the country because they don't know what to do. They're nervous at this point. It's causing a certain amount of uncertainty, very similar to what we saw last year. Do you think it makes sense for these board exams to happen in a physical form now?
I don't think so, because right now, we are almost in the middle of April. And if the board exams are going to happen in May, it's going to be a big problem. We owe it to our students and everybody else to protect them and protect their family members. Whether the situation will improve by June or July, I cannot really predict at this time. It depends partly on the behavior of the virus and partly on our own behavior as a society. But I believe we ought to look at alternate methods, and I hope whoever are the authorities in charge are looking at alternate methods of how to, if not postpone, if they're going to hold the exams, how to do it in a manner that helps the students, whether it's going to be internal assessment or whether it's going to be online exam, which again is going to disadvantage some students. We'll have to look at all of it. It's a traumatic experience to lose academic years, and I have had that. I lost 1 year of my MBBS program because of one of the first Telangana agitations. But at least I was already in medical college. I knew I would become a doctor, even if it was delayed. But for a 12th class student, not knowing what's going to happen at a very major turning point in her career or his career, that can be quite challenging. So I hope the authorities are looking into this, planning for their future, and dealing with it in a very empathetic manner.
Yes, and we do hope, of course, that governments take your advice. A quick question also about the vaccinations. A lot of people are saying they're due for their second shot at this point. If there is a shortage, people are going to the centers after their appointment, being turned away at this. If there is a shortage and the appointment and the second dose doesn't happen exactly on time, it's delayed, is that a problem, doctor?
No, take it whenever it's given, that I would say, because even the actual duration is not certain. For example, AstraZeneca claimed on whatever basis initially that 8 weeks is better than 4 weeks and 12 weeks is better than 8 weeks. And that is how the British authorities are now permitting it. The WHO said anywhere between 8 to 12 weeks. We in India have now said anywhere between 6 to 8 weeks. And we do not know whether that's true for other vaccines as well. So I believe that taking at 6 weeks or 8 weeks should not be a problem. And you should go and get the second shot and not feel that just because you have not had it on the dot, you should actually stop taking the vaccine. A slight delay doesn't matter.
Is there a likelihood that the second shot might not happen because of the demand and the shortage?
Well, ideally, I hope the appointments that have been given will be kept. And they're not going to be delayed, if at all, more than a few days. But I would say, even if it is delayed by 4 to 6 weeks after the initial scheduled time, go ahead and take it. Because there is some immunity that has already been set in motion by the first shot, which is called the priming shot. And what the second shot does is act as a booster. And you will definitely get a booster, even if you delay it a bit.
Do you also recommend, in Maharashtra, for example, they recommended that all household staff, people who work as cooks and maids and drivers, be tested every 15 days. That resulted in a shortage of test kits because all delivery boys, everybody was suddenly getting tested by their employers. And we ended up with a shortage of tests. Do you recommend regular testing, or should people only test if they find symptoms?
Well, we must understand the limitations of tests, because I think some of this confusion arose because of that slogan of test, test, test last year. And everybody was going on TV saying, why are we not testing this much? We are testing low. Of course, we must test, but understand the strengths and limitations of tests. The RT-PCR test has a sensitivity, that means the ability to pick up the virus when it actually is in the body, only up to 60%, maximum of 70%. It varies. If you test too early or test too late in the infection, it will turn out to be negative because you can't detect a replicating virus, which is what the test depends on. If your swab collection is poor, if your transport is poor, if your lab procedures are poor, again, you'll miss cases. So we're talking about 60% of the cases being picked up by RT-PCR. If you take the other test, which is the rapid antigen test, compared to RT-PCR, it only picks up 50% of the cases. So even in the best of circumstances, if you say 70% by RT-PCR and 70% of that by the rapid antigen test, using a rapid antigen test, you're still missing more than 50% of the cases. So that is the problem. So you just can't go by the test itself, and saying once in 15 days really doesn't make sense. So you ideally go by symptoms or history of exposure. If somebody who you feel is working with you has been exposed to a person who has had proven COVID, whether in office or at home, then your index of suspicion is high, and then you ask the person to get tested. But subjecting routinely everybody who is working with you for every 15 days for the test is neither productive nor polite.
That's a good way to put it. Doctor, we're also seeing reports. NDTV, for example, had a report yesterday of people having to buy Remdesivir in the black market at 6,000 rupees per dose. Again, bad management. Are people, is the reason that we didn't assume that the cases would get this bad? Because this is actually public health management for a drug like Remdesivir that we've been exporting as a country.
Let me give you an answer which is going to surprise you a bit. I'm a member of an executive group of a steering committee of the WHO's Solidarity trial,
yes,
which has been conducting most of the drug trials apart from the big recovery group in UK. Now, Remdesivir in the WHO Solidarity trial, which is the largest trial test of Remdesivir, has shown no benefit on reducing deaths. It has not shown any convincing benefit on reducing the hospital stay. And let me explain why this notion came about. First, the big US trial, but which was much smaller than the WHO trial, actually declared first that they were going to look at the effect on deaths. But then midway through the trial, they changed and said, we'll look at the effect on hospital duration stay, whether people recover faster, because
yes,
they didn't find the effect on the deaths. But even there, what they reported as a benefit on reducing the hospital stay was open to question because the trial had about 1,000 patients, whereas the WHO trial had much larger number. And when you have a trial with relatively smaller numbers, then you cannot assure the comparability of the treatment arm with the control arm. And there were some differences in the use of oxygen, in the use of ventilators, etc., between the two arms. So you cannot even swear that hospitalization time was definitely reduced. Could have been, we do not know. The Americans believe that it helps and they continue to use it. The British mostly start disbelieving them and they prefer to use other things. In India, there has been the feeling that, oh, it helps because initially the Americans introduced it and we also put it up. But given the fact that it doesn't have any difference on deaths, the hospital duration stay being reduced, that benefit is questionable. Spending that amount of money and running after it and getting panicky that it's running into shortage, I think is inappropriate. Those doctors who believe in it in India can use it, certainly. Let them do it. But it is not the magic wand under any circumstances. There are much cheaper drugs which are proved to be much more effective, like dexamethasone, for example.
All right. Doctor, thank you so much for speaking with us today and answering all of our questions so patiently. People are still asking questions. They're saying that doctors have recommended Remdesivir for a grandmother, how much it costs. And so obviously this is something that we're going to have to, deal with slowly. We're going to discover more things about this virus as we go along. But as of now, does it remain that we just wear our masks and stay at home as much as we can, maintain social distancing? Is that still really the answer to the problems that we're facing?
Yes, however complicated matters may look, the solution is relatively simple. Whether it is the original virus or the mutated virus, which is more infectious, the best defense we have is to wear a good mask, wear it properly, and keep that distance and avoid crowded incidents. That is the most important. And if we can maintain that discipline for about 6 to 8 weeks running, then we would have definitely overcome this problem. But if we do not do that, then we are going to be in a problem. And lockouts are not the solution.
Also, lockdowns are not the solution. You said, is it also true right now that we've discovered that surfaces, that the virus doesn't pass on surfaces as much as we thought it did, which is door handles and lifts and things like that? It's mostly from conversation and eating together and breathing on each other. Is that correct?
True. Initially, there was a lot of suspicion about the virus surviving for long and surfaces. Then it's been discovered that it's not really true in real life. The initial studies were on placing a huge amount of viruses on a surface and then trying to find out how long it lives. not the amount of virus that actually gets transmitted during a conversation in a closed room. So that was overestimation of the danger in the first instance. And now people have realized that. Again, surface to surface, there is a variation. The virus doesn't stick much on porous surfaces, whereas on a hard surface, like a plastic, or a firm surface like a plastic or steel, it sticks longer. On paper, it sticks much less. So there are variations in that. But in general, on surfaces, it doesn't stay long. It is in the air, either in terms of droplets that are directly reaching you, or virus clouds that are forming in the aerosol, which is a problem. And the aerosols tend to form more in a closed room, and in an ill-ventilated room, because then they don't disperse easily. So our worry should be much more about that than about the surfaces.
Okay. Thank you, Doctor, and I hope that we can keep having these conversations and clearing doubts for our audience, as they watch them. One quick question, sorry, that I forgot to ask you. You did say lockdowns are not really the answer. We have, an announcement likely coming from the Maharashtra government as we speak. Do you believe that lockdowns won't really solve the problem?
Well, let me put it this way. If the situation is really getting out of hand, you are unable to discipline people into proper behavior, and you're finding that there is a tremendous amount of rush on your resources, you can certainly go in for a lockdown for a few days. A, to start planning, conserving whatever resources you have and use them better. And C, to send a strong signal to people that they have to now adopt COVID-appropriate behavior. But it cannot happen without everybody from top down, from the topmost in the leadership to the constable on the beat, observing the precautions that they are advocating for people. And that is important for the simple reason that if we actually have a lockdown, whether it's for a few days or a few weeks, and at the end of it, you feel the problem is over, get back to your original behavior, then you're again going to get into trouble. It is like somebody going into intensive care unit, coming out of it and immediately lighting up a cigarette. You have to make sure that your behavior is much more appropriate. You give up your tobacco, you get your blood pressure checked, you get your diabetes checked. You have to continue that cautious behavior for some more time to come. Otherwise, you get back into intensive care unit again. So a lockdown, if necessary, may have to be a temporary solution, but not one to be repeated too often.
Right. Okay, Dr. Ray, thank you so much for speaking with us. Like our audience also said, this has been extremely helpful, but we hope we can keep coming back to you and asking you our questions in the future.
Happy to. I miss your dog this time.
My dog is taking a nap, actually.
Okay,
on
good.
the sofa.
Right.
So Dr. K. Srinath Reddy there, who is a public health expert and a voice that we should all pay very, very close attention to. Also saying that exams should ideally be either postponed or cancelled because it does not make sense to have them right now. We do hope that the central government that makes these decisions in the education department pays close attention to voices like Dr. Ray. Thank you for speaking with us.